ఓం నమో వెంకటేశాయ. అందరికీ నమస్కారం అండి. సో ఇవాళ మనతో ఎవ్రీ టైమ్ డాక్టర్స్ తో మనం ఇంటర్వ్యూ చేయడం జరుగుతుంది ప్రతి ఒక్క దానికి. లైక్ వి హావ్ డిస్కస్డ్ ఆన్ మెనోపాజ్, డయాబెటీస్, హైపర్టెన్షన్ ఇలా అన్నిటికీ. ఈ రోజు మనము ఒక వారియర్ తో మనము ఇంటర్వ్యూ చేయబోతూ ఉన్నాము. అది ఎవరో కాదు, మనకు రిధిమా తయాల్ అండ్ వాళ్ళ హస్బెండ్ నకుల్ గారు కూడా జాయిన్ అవుతారు. సో మనకు రిధిమా తయాల్ అనేది అనేవాళ్ళు క్యాన్సర్ తో, అంటే మనకు చాలా భయంకరమైన విషయం కదా, బ్లడ్ క్యాన్సర్ అనే ఒక భయానకమైన క్యాన్సర్ తో తను సఫర్ అవుతూ, తను ఎలా ఛాలెంజ్ ని ఫేస్ చేసుకుంటూ తను హౌ షీ హాస్ ఓవర్కమ్ దాట్ వన్ అండ్ షీ ఈస్ లీడింగ్ ఎ వెరీ హ్యాపీ లైఫ్. సో అలాంటి ఒక వారియర్ తో మనం ఈ రోజు ఇంటర్వ్యూ చేస్తూ ఉన్నాము. ఇట్స్ రియలీ హ్యాపీ ఫర్ మీ టు హ్యావ్ ఎన్ ఇంటర్వ్యూ విత్ రిధిమా తయాల్. Hearty welcome to you, Ridhima. Hearty welcome to you.
Thank you.
So we welcome you to Tirupati. It's from Andhra Pradesh, Lad Balaji.
Yes.
Yes.
Thank you so much.
Yes. So Ridhima, when I saw the interview with Shivangi ma'am, so I came to know that you have been suffering from it was a very deadly blood cancer, what I came to know from that
Yes.
one. So can you enlighten on that one? कि कितनी साल से है वो, और
Actually, what happened was I started having symptoms around around Diwali in
of which year?
2022. No, not exactly cancer, but there were some allergies and some infections going on in my body. I started having those symptoms. And for the initial phase, I had infection in my vagina. So when I consulted a dermat, so he said ki go and test your sugar, because that might be because agar sugar spike hogi, तो इस वजह से infection है. But उसके बाद gradually, one after the other, there was something going on with my body. And there was a trip to Udaipur with my family. It was planned for New Year's, but it got preponed to 18th of December. The moment I landed in Udaipur,
Which year? Which year was?
2022, December 2022.
Okay.
Yeah, the moment I landed there, I started having symptoms. I was seeing black worms in front of my eyes with open eyes. I was seeing them in the bright daylight. And for whole 3 days, I was having fever there. And I could not walk at all. I was so breathless. I have been doing gym for the last 3-4 months before that. But still, I was not able to walk for even 5 minutes. And I was so helpless. Ki what has happened to my body suddenly? My in-laws were walking in a very good speed from me. And I was catching my breath every time I was walking or climbing these stairs. So when I came back, I visited my doctor. He said, get the blood works done. And I told him I'm having these small worms I'm seeing in front of my eyes. He said, get your eyes checked. So when I went to the eye specialist, he checked my eyes. He said, you're having blood clots on your retina. And he said, this is not common. This is very unusual. And this is not an indicator of a problem in your eyes. It is an indicator of problem somewhere else in your body. He said, consult your doctor and do some blood works. So when I got the blood works done, it was on the eve of Christmas. Not eve, on the Christmas, 25th of December, I got the blood works done in the morning. And by the night, it came, the reports, it was 4 point something hemoglobin I had that time. And I was admitted in emergency to the nearby hospital. And on that night, I was transfused with a unit of blood. So I thought ki something major is there, because blood transfusion is not very common. So I thought ki something major is there. But ठीक है, यही था कि it's okay, देखी जाएगी जो होगा. So next morning, nobody was there with me, and I was like, what has happened? I don't know. So next morning, doctor broke the news to my husband and my family that she might be having cancer. So they shifted me to a cancer specialist hospital that time. And after that, I was admitted on 26th there. And from 29th onwards, I started with my chemotherapies. And it went on for 6 months, 6 cycles. It went on till May. So I had 6 rigorous cycles, out of which first was the induction one. Second was the main cycle. Matlab, that was so intense. It went on for one whole week. I was plugged onto a machine 24 hours for one whole week. Matlab,
Oh
even if
my
I had
God.
to use the washroom, I had to take that machine with me. And
Uh,
only the time they used to change the injection in that machine, that was my time to change my clothes and everything to freshen up. Just those 5-7 minutes. And after
my
that,
God.
I had three more chemos, maintenance chemos. And I'm still going with my medications. So, but yeah, life is good now.
Mhm. So it has been 1 year and 5 months, 1.5 year.
Yes.
Okay. So how do you feel this period to be? The time you were got diagnosed to the time now.
See, honestly, I've never thought about it a lot. As in, I was living the life as it was coming to me. I was
Hmm.
living it day by day. I was not thinking about how much time do I have left or anything like that. It's just that my husband asked me, Ki, give me a date by which you think you'll be fine, totally fine, cancer free. So I decided upon my son's birthday. It was in June 14th, which was not practical by when he asked me that time. It was not a practical date for him. He said, think of something practical. Don't be so emotional and give me a date. I was like, no, I will be fine. I will cut his cake in my drawing room. And it happened. I got discharged from my last chemo on 26th of May. And on
Oh,
15th of June, I was traveling. I went to
okay.
Gangtok to celebrate his birthday.
Oh, that's amazing. So usually people, I mean anyone who have been diagnosed with cancer of any type, they
Right,
go low. They go low. They become depressed and they
right.
think that life is going to end or something. The word cancer itself makes
Exactly.
huh.
First
So it
question that
gives a
comes
lot
to
of
your mind is how much time do I have left?
So how did you battle?
No, I never thought of that. Instead, I was more concerned about my hair. If I will go bald or not. I had very long, beautiful hair, and I was like more concerned about them. One of my sister-in-law, cousin sister-in-law, is a doctor. So when she broke me the news, na, so I would just ask ki if I'll go bald or not. She was like, "Are you concerned about that? मतलब इतनी intense news के बाद you are asking me this question." So the only thing was my father told me one thing: do not think of anybody else, just think of your own kids and your husband. That is it. You have to think about them and then you have to fight this. Because I
Hmm.
personally lost my mother 3 years back. So I went into severe depression after that. So that depression, the reason of depression became the reason to live, to fight from the
Hmm.
cancer. Because I thought ki if I am feeling such a loss of my mother at this age when I am full settled in my life, so my kids are very small to experience that. How can I let them experience that? So I had to fight it anyways. So my kids were
Okay.
my driving force.
So that was your motivating reason.
Exactly.
So any time in the process did you go low?
No,
No.
never.
So
First
how
time
did
when
you?
after my first discharge, after my first chemo, when I went back home, I washed my hair after around 30 days. 21 days I was admitted in the hospital and 9 days before. So after 30 days, I washed my hair. So half of my hair came down. So that was the only time, that was the only day when I cried my heart out. There was this much of pile of my hair lying in front of me. I
Oh.
cried my heart out. But after that, it did not bother me at all. Matlab, I have pictures in my phone with me as bald, but then also I'm smiling in those pictures. I made a
That's
point to always click a picture with a smile, never with a frown.
That's great. So how did you like try to, because it is like rather than a diet and exercise, it is the mindset which comes
Exactly.
first. So how did you manage? Because the surrounding people near and dear, everyone starts asking you in a concern or sympathy or empathy way, which is more
See,
concern for us. So how did you battle that part and make your
in
mindset very
that case,
strong?
my family became a big blessing for me because they isolated me from everyone. My husband took my phone. You're not going to talk to anyone. I'd never Googled anything. what has happened and what is going to happen or what might happen. Nothing at all. And my husband was there with me 24 hours. Nobody else I was in contact with. Only I used to see my kids on video calls and my husband used to talk to them, nothing else. And he did not let me talk to anyone so that my frame of mind would be disturbed. There were people, once we were settled in this phase now, there was a time somebody video called him and I was having a pick line in over here, pick line.
Hmm.
Whole treatment
Yeah.
used to do that. Yeah.
Marking.
So I was getting it dressed. So I had to keep my hand like this. So the person on the video call asked, is her hand paralyzed? And there were people who were asking, can she recognize you? And we used to laugh at those
Oh,
things. Instead of being motivated by those things, we used to
crazy.
laugh. Ki, how foolish can people be? Matlab, cancer is not that thing yet. Ki, theek hai, we are fighting it. So there was a time when we
Yes.
used to laugh at it, but we never thought ki, this is going to take my life. Or my
Hmm.
husband was my biggest blessing.
Asset. Yeah, that's really great. So that means that supporting people
Of
should be
course.
very strong. And they were very lucky to have
Yes.
Nakul with you. So we will have interview with Nakul also. So then how you were without phone, how are you managing that 6 months of the time or 5 months of the time in hospital when you were
I
undergoing
I
chemotherapy?
used to read books. I'm very fond of reading. So I used to read books and I used to, there was this uh, Hanumanji part and all that was used to on and on in my room. And even the nurses, you'll be shocked to know, even the nurses used to come and tell me ki we do not feel like it's a patient's room. There's so much positive vibe in your room. They used to come, sit, chill with us.
Oh, oh,
Matlab, they
oh.
said ki
That
when we want to, de-stress now, we come to your room.
that's really great. That's really inspiring. Um, And were you not tired when the chemotherapy was going on? People tell there will be low energy, there will be a lot of tiredness with the chemo, vomiting sensation.
When I was treated with my first chemotherapy, the first night after I was given the medicine, that time I had so intense shivering at that night and I developed high fever. But that time also, malab, it was not demotivating for me ki what has happened to my body or anything like that. I don't know how that power came to my mind, but I was strong ki I have to fight this off. Now, when I think
That's
about it, now I feel that it was magic or something because I am not very strong like that. I have not been such a strong person. But then, when it came to cancer, something came in me. I think my mother blessed me from above. Ki you have to fight this off, and I did it. So I have no actually rocket science or I no specific thing to tell. Yes, I did that or that. It just happened.
that's really great. That's really great. So then how were you managing your diet, exercise?
About diet, I was not having any proper diet because they used to tell me to have turmeric milk and they used to tell me to have low sugar. But that time, the taste got so bitter in my mouth due to medicines and everything. I was craving sugar like anything. I was eating so much junk that time. I gained, in my first chemo, I lost 10 kgs. And during my other chemos, I gained another 10 kgs because I was
Oh,
eating so much junk and there was no exercise at all. It's just that I was doing a little pranayam, that too, because my husband was after my life. You have to do it anyhow. Only pranayam, nothing else. No other exercise was allowed to me because of low hemoglobin. So I was only doing pranayam. It plays a very important role. Breathing exercises plays a very important role, as told by the doctor also. So I was doing only that. And after that, gradually, I have cut down on my junk. I've cut down on my sugar because sugar triggers cancer.
exactly correct.
Yeah. So I have cut down on my junk and I have switched to more natural forms of sugar like dates or khadi shakar or something like that. Not the refined sugar one.
That's great. That's really nice. So how much of blood transfusion was done to you? You said hemoglobin was 4.5.
I guess I'm not exactly sure, but I guess 25 to 30 bottles I was induced. Because
Along with the
every time,
platelets.
yes, excluding the platelets, same amount of platelets and same amount of blood. Because after every chemo, my TLC and my hemoglobin used to drop. So they had to maintain a level of 7 in hemoglobin. And they had to transfuse blood every time after the chemo. So 5 chemos I went through, and around 5 or 6 bottles every chemo I had transfusion. So there
Okay.
was an analogy for those also. My husband invented that.
Yeah, I saw that
He
one.
said,
Can you please
yeah,
tell on that?
he said, just imagine that the blood bottle is anarka juice and you're having it, and the platelets is it's light yellowish in color. So he said it's a Mosambi juice.
Mosambi. So Mosambi juice and anarga means pomegranate. So every time they used to give that one, you used to feel that one.
And also
Like it was a fruit
the
juice.
blood bottle used to be very chilled. They used to keep it in the ice box. So he said,
It's
"You're getting very chilled anarka juice, pomegranate juice. So enjoy."
Really, really very nice. And I also saw that video saying that you were never thinking that it is an hospital.
Yes. That's
So
another thing invented by my husband. He said, just imagine, I've always been a very sucker for five-star hotels and a good lavish vacation and everything. So he said, ki just imagine this is a good vacation that you're enjoying. This is a five-star property because that hospital was no less than a five-star property. So he said, just think that you're in a five-star property. It's just that you do not have to go anywhere to explore. People will come to you, nurses are coming to you, whatever you need, you get on your bed, and insurance company is paying our bills. So we do not have to worry about the bills as well. So we did that.
and sisters are the waiters or
Yes, the
it,
sisters are the
huh.
waiters and caretakers. They'll come and serve you everything that you need.
And blood is the
Blood
pomegranate
pomegranate
juice,
juice, right.
Mosambi juice is the platelets. So how the room was arranged? So I came to know that room was arranged with all motivational quotes, and you were reading a secret book or you saw the secret
Yes,
movie.
yes. I've
Yes.
read Secret book. That was The Secret is my first book of my life. That was the first book I read in my life. And on Shivangi ma'am's advice, we saw the Secret movie that time, particularly the plane crash part. So we saw that. And after that, Nakul asked me, you give me your date now. So that's when that
Mhm.
whole thing happened. So, and my doctor was so great. He asked me, just remove all these boring paintings from here and get big pictures of your kids and put them all around the room. And Nakul asked me to write your date on a paper, and he pasted in front of me. Every time you see this, you will think that yes, I have to do it.
Mm.
Mindset.
Mindset.
Exactly. See, for me, I think medicines played their part, but mindset was more important in my recovery.
Hmm. So that was the reason, like you were having all the photos and your goal, and you wanted to go home, and you were visualizing that
Yes,
you have to go, and you were cutting the cake.
yes,
So you said you went somewhere for the birthday,
yes,
your son.
yes. We went to Darjeeling.
See. That's really great. That's really great. So I also saw that in the video saying that you had cut off phones from your all relatives and your friends.
Yes.
So
I
did it help you?
Yeah, what happened was during the first chemo, the first
Hmm.
day at my hospital, a friend called me and she asked me, Ki, is it true that you have only 21 days left? That was the time Nakul decided you're not going to use your phone entirely. Only when you have to binge watch or see anything like for entertainment, then only you're going to use it, or you have to talk to your kids. Otherwise, you're not going to talk to anyone. And what the thing was, I was admitted for 21 days during my first stay. So a report had to come after 21 days, and that would decide ki how much amount of cancer I had and everything at the further course of treatment. So I don't know how that 21 days of waiting changed to 21 days of my life. But what, what other things came in between and were added. So a friend of mine called me and asked me, is it true that you have only 21 days left? I was like, I am not concerned. Is it one day or is it 21 days? I know my husband will take care of me.
That's really great statement. Really great. So that is what mindset is very important when we are going through any of the difficulties. And
Exactly.
your husband is the greatest asset for that one.
True. Very true.
And I also saw that your kids were very small, and the younger one is more attached to you. You have two kids.
Yes, I have a daughter, elder daughter, and she
Mm,
was 7 years that time, 7.5.
that time.
Yeah.
And son?
Son, he was 3.5 that time. He just completed 5 few days back.
So then, how did you overcome that pain of keeping
Uh,
your kids away,
Very
especially your younger
interesting
one?
fact I'll tell you. My son was a big mama's boy. Malab,
Mm,
he never slept without me before the day I was admitted in the hospital. And for the first time in my life, in his life, he slept without me, and that too for good 21 days in one stretch. Well, that was the time he was like after Nakul used to go back home in the morning, get dressed and take a bath and everything, and then come back to me. So that time he had to sneak away from him. Ki agar if he sees him, so he'll be after him. Ki I have to meet mama. And
mm,
when I got back home after 21 days, also na, I had to keep a distance from them because he was having cold. That was January time. It was very cold in Delhi. So he was having severe cold. So, and my TLC was very low. I was very prone to infections. So, doctor asked me to keep a good distance from the kids, and that too after having a mask. You cannot touch them, you cannot hug them, you cannot meet them in, from close. So, uh, that was very difficult. In fact, staying away from them was easier. And staying in front of them and still not be able to meet them and hug them, that was more difficult part. But then, as they say, that God gives you strength whenever He gives you the problem. So that came true with my son also. The kid who could not sleep without me and ever in 3.5 years. And he slept without me for full 21 days in one stretch. So God gave him strength also.
see, Ridhima,
Mhm.
usually kids are moldable, so they will forget things soon. But how did you manage that to stay away from them?
I had no other option. And the thing was, I was doing this for them only. So it was
Mm,
very clear in my mind, if I'm going to get low here, then how am I going to fight this?
that's really amazing. That's really amazing.
Matlab, that is like a power of motherhood that I came to know that time also, that you are ready to sacrifice time with your kids just to, have a future with them.
Mm, correct. That few months of sacrifice is going to make you stay more with your kids later.
Exactly. Exactly.
So that thought should come during that time.
Right.
So that is the biggest thing, because you are a great warrior.
Thank you so
Okay. So, like what you actually do.
I'm a homemaker and I've recently started spiritual tarot reading. I've been
Mm,
getting classes from Avni ma'am. So
that,
I've started that and I'm a full-time
that's
homemaker.
super. Super. And what about your husband?
He's a businessman.
Okay. In Delhi.
Yeah, in Delhi.
So how did he manage that 6 months without He was managing the business over phone.
Yes, over phone also, and my father-in-law and my mother-in-law came as a big support to us. My mother-in-law used to take care of my kids all the time, prepare food, send food from home because I was not liking the food from hospital. So she was preparing food for me and sending to the hospital also, taking care of the kids also. And my father-in-law was whole solely taking care of the business. That time he said, "You go and take care of her, I'll take care of the business."
Mm.
So that
So
is why
how
I
did
say my family has been a biggest blessing in this whole journey.
so how did uh, your mother-in-law and father-in-law, they would have got calls from near and dears. So how did they?
They did not talk about it at all to anybody. If anybody used to start talking about it, they used to say ki we have set a frame of mind and we do not want to disturb it at any cost. So if there's anything else you want to talk about, you're more than welcome. Otherwise, we have nothing to talk about it.
That's the
That was
environment which
their
is
statement
given.
for the whole 6 months. And once things got settled, then they started talking about it. But for the
Mhm.
6 months, they did not talk to anybody about it.
So how about kids? Do they know about it
They got to know
till today?
my podcast came out.
Oh.
I made sure I told I told all the mommies of my daughter's group that please do not tell your kids that I have cancer because see, today's kids have so much technology in their hand. Na? They have Google all the time. They have access to Google. So if my daughter used to, would have come to know that my mom is having cancer, you never know what she would have Googled and what she would have got to know about that. I did not want that to happen. If she might get some false knowledge, which is not even happening. So I did not want that to happen. So I told all the mommies of my group, please do not tell your kids that I'm having cancer. Just tell she's ill and she's hospitalized and everything. The word cancer should not come.
Mm, great. They also supported.
Yes.
They also supported. So then, what and all really, with respect to mindset, what and all helped you? Like you said, secret movie, that's law of attraction. So anything else in the mindset? Because the mindset is the biggest thing for anything in this world, but to achieve anything.
Mm-hmm.
So mindset stands first.
Right.
So to strengthen your mind, make it strong. So how did you? What and all you did, so that it will be an inspiring for others who are suffering from
See,
cancer.
as I told you, I used to read books, cancer survivor books, and there is a book, Life is Simple by Dr. Sneh Desai. I used to read that. And Mandira Beri's book, Happy for No Reason. I used to read these motivational books that time. And also, I used to, meditate. Meditate in the sense, pranayam and everything. That helped me. And the rest of the time, I was sleeping. Simple. So there was not much time for me to think about anything.
Hmm, great, really great. And did you know the survival chances or anything
No,
according to your diagnosis?
I
No.
did not know any fact about my treatment before the day the podcast was shot. Malab, the moment he was telling Shivangi ma'am the details, I was getting to know them simultaneously for the first time. I did not know anything. He did not even let me download the app of the hospital so that any reports or anything would come to me. He did not let me
Mm,
do that also. So I
great.
did not know anything about my treatment.
Mhm.
Until
So
date also,
now,
I did not know much things about my treatment.
Nakul is there?
Yeah, yeah. I'll just call him. Just give me a second, please.